Have you heard of the term kysta endometriosis? This is a term used to describe a type of endometriosis, otherwise called endometriomas or chocolate cysts. This is both a type of endometriosis, but also a type of cyst. If an endometrioma is present, this is automatically a more advanced stage of the endometriosis disease. Because they are located typically on the ovaries, they absolutely can affect ovarian reserve and egg quality. And it does happen, but it's rare for them to resolve on their own. They typically require some kind of medical or surgical intervention. The gold standard to date has been surgical excision of ovarian endometriomas, but because this often requires cutting into the ovary, it certainly can have implications for fertility, egg quality, and ovarian reserve. This type of surgical removal has the lowest recurrence rate. There are also surgical procedures where the endometriomas can be drained, but they don't have a lot of benefit when it comes to pain reduction, and they do have a high degree of recurrence. There's also a relatively new therapy in the last decade or so called ethanol sclerotherapy. This procedure involves emptying the contents of the endometrioma and filling it with ethanol. So far, the research into this therapy has been promising. It's minimally invasive. It looks to preserve ovarian function and ovarian reserve. Some studies show recurrence rates as low as 12%, and it's a relatively minimally invasive procedure. Hormone therapies like Dianogest or Bizan can also be helpful, but the results are mixed from person to person. From the natural perspective, we know that vitamin D and zinc deficiency are associated with endometrioma growth. For some reason, high-intensity interval training seems to be protective against endometrioma development. High estrogen, blood sugar dysregulation are also risk factors for endometrioma development. And poor blood flow to the pelvis and reproductive organs also seems to be associated with the development of endometriomas. I have a great full-length YouTube video specifically on endometriomas, and I recently did an interview with Dr. Martin Hirsch, who's one of my favorite surgeons in the endometriosis space, where we do talk a little bit about medical and surgical treatments for endometriomas. Head to my YouTube at the link in my bio.